We begin with breaking news about Canada's aging population. New data released last hour is forecasting unprecedented growth amongst Ontario seniors. And the report says that spike means the province will have to may not have the staff to keep up, that is. Tricia Kindleman is here with the details. Tricia, hearing that the province will be scrambling to try to keep up, concerning to a lot of families with aging family members. So what is this finding?
Yeah, absolutely. So we're looking at this population growth of those over the age of 65, but especially those also over the age of 75. Now, this is going to put pressure on the provinces in a variety of ways. As you mentioned, it's those staffing concerns, but also the cost of health care. So one of the things that people, or that this report is really focused on, is how home care could help with this situation. So now you can see the chart here that we can show you. This chart shows the expected growth up to 2030. It's a growth of about 110,000 individuals a year, or about 23%. And over the next 6 years, Ontario's over 65 population going to grow by 650,000. So now this is that group of the so-called baby boomer generation. You know, people born at the start of the North American baby boom are now well into their 70s. And within the next 5 years, all the baby boomers will be considered a senior. So now this new report looks at how this demographic is going to shift the demand. It's called the impact of Ontario's aging population on the home care sector. So again, a bit of a focus there. Now, older Ontarians on average do utilize more healthcare services, which of course then costs more. So now the average Ontarian below the age of 65 costs about $5,000 annually, about $4,900 there. For individuals between the ages of 65 and 69, that jumps up to about $7,500 per year. And that cost continues to rise as that age rises, 75 to 79, costing almost $12,000 a year in healthcare costs. So it's an expense for those provinces. They're going to figure out how they're going to be able to fund that in the future going forward.
And Tricia, also a concern, the fact that this population is growing, not only impacting staffing, but also the healthcare system in Ontario. What's the finding there?
Yeah, absolutely. So really, without about 7,000 new staff members, they're not going to be able to handle this this senior tsunami, as it's being called. So it's related to those rising costs again that we touched on. Now, healthcare workers, home care workers can save about $100 a day. It's about half the price. Here's a bit more from the CEO of Home Care Ontario.
Home care is the only part of the healthcare system that can be scaled up fast enough to meet this demand. And it is the solution to helping people stay at home where they tell us that they want to live at home, they want to receive care at home. So home care is the only part of the system that can do that.
So again, about 7,000 additional workers going to be needed there to be able to provide that care in home, as they're hoping to be able to do. Stats Canada also tracking this growth. They attribute it to that baby boom again, and also a growing life expectancy that we're seeing. So it's going to mean a lot more consideration put into not just these care homes, but that long-term care program as well going forward.
Yeah, a growing concern as many Canadians living longer. Tricia, thank you so much for this.
Thanks.